So now that you've picked up your whitening trays, you're all ready to go. So how does it all work? So a couple of weeks ago when you came in to have the scan or impressions taken to have the trays made, we will have given you your whitening kit. It'll be either this one or one in a black tin, depending on which type of whitening gel you have. And inside the tin, you will find 4 syringes of the whitening gel. We will also have given you a tube of toothpaste when you came in to have the impressions taken, so hopefully you've been using that for the last couple of weeks. It's a desensitizing toothpaste, which will help with any sensitivity that you may get. So inside the little box, you'll find 2 whitening trays, one for the upper, one for the lower. So I've just got the upper one for today, just to show you how it works. In order to fill up the tray, there's a little nozzle on the top of this whitening syringe. It's a little bit tricky to take off, but all you need to do is to twist it off and then dispense the gel. Just push the little syringe down until you can see the gel coming down the little nozzle of the syringe. And then all you do is you pop this into each of the little tooth indentations on your whitening tray and just dispense a little bit out. If you look closely on your whitening tray, just on the front surface, you'll see a little sort of button, if you like. You need to dispense the gel into that little button on the front surface of the tooth indentations on the tray, just enough to fill it up. And you'll slowly go around the whole of the tray, dispensing a little bit of gel into each of the tooth indentations. Then when you're ready to pop it in, all you do is just pop it in like that, and then press on the front of each of the teeth indentations, and that will spread the gel across the front surface of your tooth. If a little bit comes out, it shouldn't do, but if a little bit comes out, just wrap a tissue around your finger and just take off any of the excess. Depending on the sort of whitening gel you've got, you will leave these trays in for, if it's the nighttime one, minimum of 6 hours, so probably just to wear it overnight while you're sleeping. The one that comes in the white tin is the day white, and that just needs to be worn for an hour and a half. And you will do this for between 10 and 14 sessions. So a few do's and don'ts for while the duration of the whitening process, so over the 10 to 14 days and a few days beyond, is to try and avoid, in fact do avoid, not just try it, do avoid any sort of highly coloured foods. So if you imagine dropping some food on a white shirt, it would be a very nasty stain to get out. So things like curries, chilies, red fruits, black tea, black coffee, red wine, anything that would leave a nasty stain on a white shirt. So try and avoid those. And for a few days after the whitening process has finished, then you can go back to all of that. You're likely to see a change in the shade of your teeth after perhaps 2 or 3 days of the whitening. Along with that may come a little bit of sensitivity. Hopefully the toothpaste that we gave you a couple of weeks ago that you've been using prior to starting the process will have helped sort of alleviate any of that sensitivity. But you may still get a little bit of sensitivity, might be generalised. I tend to get it just localised in a couple of teeth. It can be a bit alarming if you're not expecting it, but it is a temporary thing, and once you've finished with the whitening process, it will go away. Once the whitening process is finished and you've done your 10 to 14 days or you're happy with the shade, it's probably wise to use this desensitizing toothpaste for a few days after the whitening process is finished, just to help with any sensitivity that you may have. At the end of each tooth whitening session, so either overnight or an hour and a half during the day, to remove the trays, just go over to the basin and just take them out. So they're quite easy to take out. You just need to get your fingernails underneath either side and just pull out. You will find that the tray has quite a bit of excess gel in there, as will your mouth. So the first thing to do, really, just rinse out your mouth, clean your teeth as normal using the desensitizing toothpaste, and then just gently clean the trays by running them under some cool water, not hot ever, and just a dental toothbrush just to remove all the excess gel. Shake them dry, pop them back in your case ready for next time.